Hi, my name is Jennifer Sanders. I'm going to be your nurse today. I'm a student of the University of Louisiana, and I'm here to conduct an abdominal assessment on you. To begin, I'm going to look at the contour of your abdomen, and by doing so, I need to expose your abdomen. So I'm going to pull your gown up to this xiphoid process, down to the symphysis pubis. The first thing I'm going to look at is the contour of your abdomen, and I can do this by looking from two different angles. I can look from the side and also at the foot of your bed. Or below the patient's feet. I am noting for contour whether the patient's abdomen is flat, rounded, protuberant, or scaphoid. Okay. The next thing I want to do is look at the skin tone, looking for scars or lesions, and noting if the position of his umbilicus. Is it introverted, everted, or if it's centrally located. In this case, his is centrally located. It's coming right down midline of the abdominal cavity. It's midline, so it's centrally located and it's inverted. The next thing I want to do is look at the color of the skin. Notably, the abdomen is going to appear lighter than the rest of the body. That's because it doesn't have as much sun exposure. Also, on a lighter complected person, you may perhaps be able to see veins underneath the skin. If there is a prominent vein pattern, especially with dilated veins, that could be an indicator that the patient potentially has liver disease or portal hypertension. In that case, that would be a red flag. The next thing I need to do is listen for bowel sounds. And to do this, I'm going to use an imaginary line and divide his abdomen into 4 quadrants. I'm going to start from the right lower quadrant, because this is usually the area where bowel sounds are most frequently heard due to the iliac cecal valve. I'm also going to use the diaphragm of my stethoscope to listen. And bowel sounds are quite commonly heard several times a minute. They can be normal bowel sounds, hypoactive, hyperactive, or you may not hear any at all, which is an absence of bowel sounds. And this is also a red flag, because this could indicate that there's something wrong, potentially an ileus. So this finding, you would probably notify the physician for this. Listening to the right lower abdomen first, or right lower quadrant, sorry. Going in a clockwise motion. And down to the left lower quadrant. The next thing I would want to do is percuss the abdomen. And to do this, I'm going to place my finger down on his abdomen, flat on his abdomen, using my middle finger and tap. And the sound that you should hear is tympany, which is the normal sound of the bowel upon percussion. The next thing I would want to do is assess the patient for any herniated areas. Typically, hernias occur around the umbilicus, around any scarring, or in the groin. I'm also going to feel for so I'm palpating right now, and I'm also going to feel for any pulsation or masses. In here, in the groin. Another thing I would like to do is palpate using my fingers. If the patient's ticklish, you can place his fingers on his abdomen with your fingers on top to palpate. If not, use your fingers with your fingers close together and go in a circular motion. And you're feeling the abdominal wall and what's under, how the tissue feels underneath. And you should not feel any bulging. Again, that can be an indicator that there is a hernia. Another examination of the abdomen is assessing for abdominal aortic aneurysm. And to do so, you would want to start from the xiphoid process, midline to the below the umbilicus. And you would listen with your stethoscope using the diaphragm. No, the bell, I'm sorry. When you're listening for any bruits. If there is a bruit, that could be an indicator that the patient has turbulent blood flow within the aorta, which can indicate an aneurysm. And this is another red flag, and you would want to notify the physician of this finding. So I'm just going to turn the head of the stethoscope to the bell and listen. The last thing you would want to do is, after palpating, which is the last thing in the abdominal assessment, you could also listen, and I forgot to mention when you're checking for a hernia, you would also have the patient raise his head or either raise his knees, and you could support his legs by using a pillow. And what this does, this will increase abdominal pressure, therefore exposing any herniated areas. You could ask the patient to raise his head, or you could, again, have the patient raise his knees and perform a Valsalva maneuver, which would include holding the patient would have to hold his breath and bear down as if he were having a bowel movement. And again, you're assessing for any herniated area. Typically, hernias again are around the umbilicus, any scarred areas, or the groin. And lastly, you would have the patient sit upright, and this is also part of the abdominal assessment. You're going to check for any, let me reverse that. One more thing, you need to check for rebound tenderness in the abdominal, in the abdomen. And to do so, you would press down firmly, not to hurt the patient, but enough that not to hurt the patient, but down at least 1 centimeter if the patient can tolerate that. Press down and release. If the patient has any abdominal tenderness or pain, upon release, the patient, if he complains of pain, then that is a clue that there could be appendicitis perhaps. Appendicitis usually has rebound tenderness. So that would be acute rebound tenderness if you press down 1 centimeter down into the abdomen, releasing quickly, and the patient complains of pain upon release. That is another red flag that you would want to notify the doctor about if this is a positive, if the patient has positive rebound tenderness. And lastly, part of the abdominal assessment, you would have the patient sit upright to examine for any kidney tenderness. So the patient would sit upright. I'm going to turn the patient this way. You can have the patient sit on the side of the bed, and you would want to place your hand oh goodness. You would want to place your hand over the kidney, flat on the surface, and use the other hand with a closed fist and hit. If the patient has pain, then this is an indicator that something's going on with the kidneys. So I'm going to do this so you can see. Oh, let me use these pillows to support the patient here. You're going to assess one kidney to the other kidney. Again, placing your hand over the kidney and hitting with a closed fist with the other hand on top of your hand that's on the patient's back. Repeat, assessing the other kidney. And again, if the patient has tenderness, that could be an indication that the patient has something troubling his kidneys. This concludes my abdominal assessment. I'd like to thank the patient for his participation. Thank you.